Welcome back to CBS Mornings, and we have an update to a story we told you about in January on how a medical coding change could limit reconstruction options for women who have lost a breast to cancer and want to avoid implants. We partnered with KFF Health News to learn more and met a young mother from Central Illinois to see how some patients are fighting back. We should point out, following our earlier report, the government agency that oversees coding set a hearing to review the change. That's tomorrow. Consumer investigative correspondent Werner has more.
And we got some squish.
Kate Getz never thought she'd become an advocate for breast cancer survivors. She's an accountant and single mom to daughter Nora.
And then go wash your hands. She's 8. She's in 2nd grade.
But this past January, doctors diagnosed her with breast cancer and told her she needed a mastectomy.
It's not news that you expect to hear at 30. It's a scary moment.
Then she had to figure out what kind of breast reconstruction she wanted. She knew she didn't want implants because the FDA says they should be replaced every 10 years. Instead, she wanted a natural reconstruction using what's called a deep flap procedure, in which a surgeon removes skin, fat, and blood vessels from a woman's abdomen, essentially doing a tummy tuck, then uses them to create a new breast with her own tissue. The problem? She couldn't find a surgeon in her area to do it. Then she saw our CBS News story from January, explaining that a change in the way the government codes the procedure is about to make that deep flap surgery even harder to get. Some insurance companies had already started sending out letters like these, saying their reimbursements to doctors would drop drastically. As Texas breast surgeon Dr. Elizabeth Potter told us then,
make no mistake, women who want this surgery and have money will always have access to it. The only people that this coding change affects and hurts are women who need access through insurance.
I felt like I was on just a ticking time bomb. There's only so much time for me to get this procedure before my insurance company won't pay for it anymore.
Sure enough, when she reached out to her insurer, Cigna, it was already lowering its reimbursement. The company told her in this March 29th email that it would only pay for the deep flap under the new, lower-paying code. Getz faced the task of finding the rare surgeon who would accept that lower insurance payment. Her only other option? Pay tens of thousands of dollars in cash.
It's not even an option. I'm a single mom. We get by, right? But I'm not wealthy by any means.
Now she's become one of many voices pushing for the code change to be reversed. On social media, she called out Cigna, posting this picture of her mastectomy scar.
Why did you do that?
I felt highly motivated that women needed to start sharing their stories. I felt like the only way we were going to get insurance companies to change and to roll back what they were doing was they needed to hear us. I think they need to see us, and I think they need to hear us.
But how did that code change occur? The Centers for Medicare and Medicaid Services, or CMS, the government agency that oversees coding, pointed to the American Medical Association. But when we asked the AMA, they told us they never asked CMS to get rid of that higher-paying code. So who did? We found this document from 2021 showing that the lobbying association that represents 34 Blue Cross and Blue Shield insurance companies nationwide submitted a request to discontinue the higher-paying code for deep flap, saying it was no longer needed. Medical coding researcher Dr. Karen Joint-Maddox says of the association's move,
the insurers presumably decided that they wanted to pay less and took the tactical approach of trying to get that procedure rolled back under a code that was a less expensive, less resource-intensive, lower-paying code. The upshot of that is that women who need this procedure are left to foot the bill.
It sounds like you're saying that maybe patients were left out of the equation here.
I think patients are generally left out of the equation, unfortunately.
As to the coding change, the BCBS Association now tells us we are examining our position and are currently in discussion with our member plans. In April, Cigna agreed to pay the higher reimbursement under the old code for Getz to have a deep flap reconstruction and told us in a statement they have paused using the lower paying code and are reprocessing deep flap claims.
It is surgery time.
On May 15th, Getz had her surgery, but she says she's not done advocating for other survivors.
I'm fighting for women around the country to have access to the surgery.
Sounds like you're going to keep fighting.
Yeah. I'm here for the long haul.
Both Cigna and Blue Cross Blue Shield told us
and KFF Health News. They're committed to preserving affordable coverage and access to care, including Cigna surgery for breast cancer patients. And by the way, Dr. Potter did Kate Getz's surgery.
Hey, that's great.
She had to travel to Texas, mind you, to get it done,
Yeah.
but Dr. Potter helped her out.
Yeah, I mean, insurance companies are for-profit organizations, so they're also committed, in addition to their customers, to their shareholders, and they want to make a profit. So there's that accusation that they shifted this code in order to make a little bit more money. They say no, but we'll see.
That's a great point, though. You're not making an excuse, but people have to realize it is for profit.
Yeah, it's a business.
Yeah.
Well, the
It's a
question in
business.
this case really is there a middle between this higher paying code that microsurgeons say they need payment for a more complicated surgery, and they're saying you really just can't jam it under a lower paying code and say that's enough because you're limiting the availability only to women who have the money to pay cash.
Right.
Tens of thousands
And
of
should
dollars.
that be the case? I think
Yeah.
most people would say no.
Yeah.
Agreed.
Yep. All right, cool. And
Great
thank you very
reporting.
much. Appreciate it.